of it is political. I think, Biden clearly is positioning himself for another run for president, and strengthening the position of his party with a fragmented House and Senate control. So part of me agrees, not having to wear a mask when I go into a grocery store, and not, that being the first 15 minutes of every conversation with friends and family. We've kind of gotten used to it. Part of it is we've ignored it, but to someone who lost a loved one, like every, what is it, every however minute, or who's losing a loved one, someone's in the hospital due to COVID. We're not a healthier population. So it's still going to be a risk, especially for those with chronic conditions. So in one part, yeah, we've kind of turned the corner. Part of it is we've learned to live with it. But for hospitals, it is still very much a crisis for them. And I think you're going to see that in pockets around the country, that hospitals are going to say, look, we either need some more funding, or we're going to have to shut down. And, so far, healthcare in particular, hospitals haven't been too big to fail. We'll bail out the airline industry, we'll bail out the banking industry. Hospitals have gotten some money, they needed it. But, to me, for them, it's still, if I were a hospital CEO or board president, I would say this is very much a public health crisis for us, but it's swimming upstream to try and get this funding authorized. Again, I don't think Biden has the capital to do it, like the previous, like Trump, authorizing all of this money. We needed to do it at the time. And again, we look more like a public health system that you'd see like in Europe. But I don't think he has the ability to do that now. So it remains to be seen what the net effects of this are. But the prognosis for health systems, for hospitals, is not rosy. It's a bleak picture for them. Do I agree with it or not? Again, there's more political undercurrent there. When our debt is $30 trillion. But I also know that if we invest in, and this is my personal opinion and my soapbox, if we invest in health, prevention, and wellness, and keep you out of the hospital, that lowers the cost of care for everybody else. My cost of insurance as an employee of university goes down. That was the intent of Obamacare, and economically it was sound, but it just became so political that anything attached, rather than looking at what's best for Americans, it's kind of what's best for the party. So I'd like to see more investment in public health to keep people, particularly those who are at risk, certain populations that have been marginalized or just don't have access. I'd like to see more investment, but the question is, who's going to pay for it? You ask the average American who's paying a lot more in gas and groceries and rent, are you willing to pay in taxes an extra 5, 10, 15% more to cover those? I don't know. I wish I could say that our fellow Americans would say, sure, I'll pay more. But it's kind of like, no, I've got insurance, we're covered, so I'm good. Let somebody else figure that out. But it is a public health crisis, not having access to reasonable preventive and primary care services. Again, if I can maintain your health and manage your diabetes, your asthma, your hypertension, and do that in a lower cost setting and keep you out of the hospital, when you come to the hospital, especially if you don't have the ability to pay, who pays for that visit? We do. We taxpayers do. And we pay for more, also those who work pay for more in our private insurance. So there's a great article called "Who Really Pays for the Cost of Healthcare?" I'm glad to send it to you. It's by Ezekiel Manuel and Victor R. Fuchs. Is written a few years ago. We say, who covers your insurance? Well, my employer does. Well, you get insurance, higher cost of insurance benefits instead of getting higher wages. We pay higher taxes to cover Medicaid and Medicare. So we Americans, taxpayers and workers, pay for healthcare. So I just don't think, we have that mindset in this country that pay more now, pay less later. We tried with Obamacare. It helped, but still not there. So